My name is Diana Gutierrez, and I am the manager of the Community Health Education and Outreach Program at Mano. I love the vision and the mission of Mano of empowering immigrant families to become full participants in their community. For our program, empowerment means helping connect and educate community members with information and the tools that they need to live healthy lives. I have been with Mano for more than 8 years, and I am committed and invested in the organization because I am convinced of the value of education and the empowerment that it develops. I am a true believer in our health education program. Today, I want to talk to you a little more about our community health working program in the hopes that you will join us in our end of the year campaign for Health for Us. And probably you are wondering, what is a community health worker? Or as we call them, promotoras de salud in Spanish. According to the American Public Association, a community health worker is a frontline public health worker who is a trusted member of the community and has an unusually close understanding of the community served. Community health workers usually share ethnicity, language, socioeconomic status, culture, values, and life experiences with the community members they serve. Community health workers serve as a link or liaison between the community and the healthcare, government, and social service systems, helping to reduce health disparities and improve the quality and cultural competence of service delivery. Now, at this time, when our community, our nation, and the world are facing the most significant health crisis of our generation, the work of the community health workers and the fact that Mano has been working with this effective model is more important than ever. When this pandemic hit, our team at Mano was ready to respond. We already had our community health workers trained in community-based education, ready to learn, be trained, and then educate the community about the new COVID-19. Since March, we have heard about many families in our community becoming infected with and even passing away from COVID-19. From those early calls, our team got started with health education calls and ongoing follow-up with community members in quarantine, returning home after being in the hospital, and those wanting to be proactive in protecting themselves and their families. Since the end of the summer, and as infections have continued to climb in the fall and winter, Mano has expanded our community health worker team to include 30 community health workers who are working across both Lake and McHenry Counties. They are moms and dads. They live in Waukegan, Round Lake, Mundelein, Highwood, and other communities. They are from Mexico, Honduras, Guatemala, El Salvador, Peru, and the United States. Most importantly, they are a reflection of the community we serve and are using their existing networks to get the word about how our community responds to this pandemic in order to save lives. The sad reality is that the impact of COVID-19 is worse in certain communities. Our community, Latinos and immigrants, have been disproportionately impacted by the virus. Today, the Illinois Department of Health Statistics tells us that in Lake County, while Latinos make up only 22% of the total population, we make up 32% of the county's COVID-19 infection and only 13% of the testing performed. Just a few months ago, Latinos were making up more than 40% of all infections in Lake County. What does this mean? We have continued to work to reduce this disproportionate impact on Latinos. But we can see that with time, with access to more information and more awareness in our community, we can reduce the spread of COVID-19 and we can protect ourselves and our families. Mano a Mano's community health workers are doing that now, and with your support, will continue their work into 2001. During the first months of the pandemic, I asked a community health worker, promotora de salud, how she felt about her job as an educator in this crisis. And she replied that she didn't feel like it was a job, but rather a passion. I feel blessed and honored to do what I do every day, working with this amazing and incredible team of leaders that are making a positive difference in the community. On behalf of Mano a Mano and the team of community health workers, I ask you to join us in this fight against COVID-19. Through your support, we will be able to continue to train and support community health workers working hard in the community to educate and build capacity of our immigrant families and neighbors. Please consider make a donation today to Mano a Mano's end of the year campaign for health literacy, because we are all in this together.